الجدول هو حسب الجدول SBE 1 week SBE training 1 week trainees case presentation and 1 week trainer case presentation and the fourth week هيكون case scenarios اللي هي الكيس بيس ديسكشن ولا الكلينيكال سيناريوز ان شاء الله. فدائما بنقول الناس اللي ما شاركت قبل كده تشارك، لانه بنسجل اسماء الناس المشاركين، وعندنا لسته باسماء المشاركين في كل الدورات التدريبيه السابقه، وعندنا لسته بالناس اللي ما شاركوا خالص. فمن مصلحه اي زول يشارك يا اخواننا. وزي ما قلنا وزي ما قال دكتور ياسر قبل كده، it is not an examination, it is not judgment interaction session. It is not, we all learn. فبالتالي أخطأنا أو عملنا غلط أو ما صح، دي ما مشكلة. كله الجول والobjectives حقتنا إنه to learn and learn and learn إن شاء الله. فبخليك ياسر أنت ومهجة to start this session، وشكرا لكم.
شكرا دكتور عبد الغني. والتحسن اوريدي ظاهر، يعني التحسن ظاهر في الفترة اللي فاتت. طولنا طبعا، هنبتدي ندي شوية يعني حبة، يعني شفت يعني هينتس المفروض اكسبكتيشنز شنو قبال الكيس، ونواصل عادي. دكتورة مهجة، في زول جاهز الليلة ولا ما في؟ عندنا الليلة عشان نواصل بس في
والله
الفلو بتاعنا.
ما رسلوا في البتاع إلا أشوف الشباب.
أنا أوكي، أنا صباح الهادي دفعة 50 حكون معاك الليلة.
طيب صباح،
أوكي.
قدمتي قبال كده؟
لا.
تمام جدا. طيب وين انت محلك هسه؟
أنا في مصر.
النت كويس؟
أوكي كويس يعني لحد هسه،
تمام
إذا قطع
تمام
بس وروني.
تمام جدا. يلا هنبتدي ان شاء الله. اول كيس هذه الليله حقتنا امير البيغم. امير البيغم، a 23-year-old Indian male who has recently experienced a significant decline in mental health, referred by emergency medical service after his mother concerns um, about his paranoia and auditory hallucination. He has no prior engagement with mental health service. The task is take a psychiatric history and mental state examination. It's as simple as that. زي ما تخيلنا، زي دي توقعنا تكون عبارة عن حاجة بتاعت 15 to 20 minutes. It's a full assessment بتاعت كيس عادية.
طيب لو سمحت لي ياسر ومهجة، بنكون عايزين one trainee to take history and another trainee to conduct a mental state examination. ولما نخلص الهيستوري يشاركوا البقية إنه في حاجة ناقصة، في حاجة ما كملوها، ويدسكس الهيستوري. بعد ذاك طوال يمشي المنتال ستيت اكزامينيشن another trainee will conduct. ولا one trainee يواصل فيها كلها مع نفس البيشنت يا ياسر، أحسن مع نفس البيشنت عشان ما يقول يتغير الدكتور، مش كده؟
حتلخبط العيان
جدا. خلاص واحد يستمر يواصل معاه كله. كم 20 minutes هي بتكون؟
حاجة من 15 ل 20 minutes. دي is a regular assessment، والكيس ظاهر بتاعت سايكوزس.
خلاص معناها يا صباح ركزي معاهم في الكلام اللي هيقولوا لك، هيقرأوا ياسر عشان تعرفي تسألي عن شنو إن شاء الله.
اوكي.
اوكي فور.
Pre-reading material for managing first episode psychosis in Amir al-Begum. You're about to engage in a simulation involving a 23-year-old Indian male, Amir Khan, اللي هو ما بقى بقى مسا, who has been experiencing a significant decline in mental health characterized by paranoia and auditory hallucinations. This scenario is designed to assess your clinical skills, knowledge, and communication abilities in managing a patient presenting with the first episode of psychosis. Understanding psychosis هنا أنا أفتكر this is general. أنا هتجاوز هنا. First episode psychosis marks the initial occurrence of these symptoms اللي هي delusions, hallucinations, thought disorders, and a change in behavior and functioning. هنا a nice guidelines overview. The National Institute for Mental Health Care Excellence, NICE, provides guidelines for managing psychosis and schizophrenia in adults. Key recommendation is early intervention, prompt assessment, and intervention for individual experiencing their first episode psychosis. Comprehensive assessment, a thorough assessment, including personal and family history, substance use, and physical examination to rule out other causes. Treatment option, combining antipsychotic medications with psychological interventions. Shared decision making is vital in choosing the appropriate antipsychotic medication. considering the patient's preference and side effect profile. Support and information, offering support and information to both patients and their family carers about psychosis, its management and recovery. Communication skills. Effective communication skills is crucial managing patients with psychosis. Here are some strategies. Establish a report. A good example اللي هنا انت الليلة في الآخر هتعرفي بروحك. Hello, my name is Sabah. I'm the psychiatry trainee here in the office today. I mean, this is هنا بتسألي how are you today? How can I help you? في الآخر الليلة you introduce yourself. You ask the patient about their name. وبعد شوية يعني بس في الآخر it's an opening conversation. Establish a report. Create a safe and welcoming environment. Use open body language and maintain eye-to-eye contact as appropriate. هنا ما في عندنا eye-to-eye contact. Active listening. Show empathy and understanding. Listen more than you speak to understand the patient experience and concerns fully. هنا في حاجة عشان مثلا تكررت كم مرة فاتت. ساعات الناس they rush and interrupt the patient لما يتكلم. لما البيشنت بيتكلم خلوه يتكلم لحد ما نهايته لحد ما ينتهي. لما تعمل active listening في الآخر الليلة I'm hearing voices, the voices are bothering me. ممكن تقولها مرة مرتين. I'm sorry to hear your concern. It must have been bothering you that much that you need to come in. You show حبة sympathy. أنا أفتكر ما ولا empathy. فهمت؟ You show مرة مرتين. لما تقعد تعملها كتير بتبقى بايخة. فبس هي مرة مرتين it's a process. في الآخر إنك أنت you're showing interest in the patient. وبعدين don't interrupt the patient. ادوا فرصة يكمل كلامه. Clear and simple language.
اوكي
اللي هي
دكتور ياسر، بس عايز اسالك، احنا هنا هناخد فوكس هيستوري ولا هاخد هيستوري كامل؟
كامل.
اوكي.
That's the psychosis في الآخر، لكن هيديك 15 to 20 minutes that's a history كامل. Clear and simple language. Use straightforward language with explaining diagnosis, treatment and procedure. هي في الآخر الفوكس هنا مش على الدiscussion الناس not to jump into discussion of the diagnosis هسه في حالة ولا في treatment هسه في الآخر بعد ما تخلص الهيستوري. ممكن you can have some time to discuss and I think that you're dealing with this is a psychotic experience مثلا. So when you're presenting for the first time with a psychotic experience, we need to rule out any medical problems. It could be related to مثلا substance use. It can be bipolar disorders, can be schizophrenia. Sometimes we might need to collect more information. دي كلها في الآخر في النهاية ما في الأول. Validate feelings. Acknowledge the patient feeling and experience without dismissing them. لما يقول لك this is bothering me much. I'm hearing these voices. It must be hard to hear these voices, and it seems like this is like it's been bothering you very much. ولا مثلا I'm sorry to hear experiences. دي حبت يعني مرة مرتين ثلاثة لكن مثلا ما السيشن كله تعيد فيها. Involve the patient, engage the patient in decision making about their care plan to empower them and improve adherence to treatment. هنا ممكن تتكلم معاهم عن الليلة احنا we need to give you antipsychotics. There are several medications هنا ده مثلا لكن ما افتكر بس يعني these medication can help you to to stop the voices and to and to move on with your life. However, you need to take these medications. Without these medications, then the symptoms can come back. Is this something you're interested in? أيوة I'm interested in. أيوة and I support you in this decision. في الآخر حاجة زي كده. Questions to ask the patients. Open-ended questions. Can you tell me about what you have been experiencing lately? This is أول حاجة open-ended question اللي دخلتك في الكيس ذاته. Symptom exploration. When did you first notice these changes in your thoughts and feelings? Can you describe them? Impact on life. How have these changes affected your daily life or relationship? Safety, which is a key mark لأي case. بالذات الليلة مثلا full interview. Have you heard any thoughts of harming yourself or others? مش just ما بس كده. Do you have any thoughts of harming yourself? مش have you had any? Have you had بذاته مش حتى ممكن ساعات الناس بتفوكس on the voices or thoughts. Support system. What do you feel you can turn who do you feel you can turn to when you are feeling this way? Substance use. Have you used any substance like alcohol or drugs that might be affecting how you feel? A treatment history and preference. Have you ever received any treatment for mental health issues before? What kind of supports do you think would help you now? خلاص؟ صباح؟
اوكي معك تمام.
اوكي هنبتدي.
اوكي دي المفروض اقراها ولا هنبدأ طوالي؟
شكله اتغطى الموضوع ده مرتين. Just a second. دقيقة، الموضوع ده شكله اتضغط مرتين. جاهزة؟
اوكي جاهزة.
Amir al-Begum, 23-year-old Indian male who has recently experienced a significant decline in mental health, referred by the emergency medical service after his mother concerns about his paranoia and auditory hallucination. He has no prior engagement with mental health services. Take a psychiatric history and mental state examination.
Okay.
What do you want? You're just like the rest, aren't you?
Hello, Amir. I'm Dr. Sabah, psychiatry registrar. I'm here to understand what are you going through and to help you. Amir,
You
do
say
you hear
that,
me?
but all right. But I don't know if I can trust you. People keep saying they're here to help, but it always feels like there's something else going on. You're watching me too, aren't you? Or maybe recording this? I can't just
Okay,
talk freely.
Amir, just hear me. I can't understand you. Can you talk slowly? I'm Dr. Sabah,
Me to
a
talk.
psychiatry registrar, and I'm here to help you today.
That's what they all say. You keep repeating it, but I know there's more to it. I can't just.
Okay, I'm sorry.
It feels like everyone's got their own reasons, and none of them are good for me.
What's your concern now? What's bothering you now?
Son, that's a.
I'm here to understand what are you going through and to help you. Okay?
Microphones, things hidden in the wall.
Okay, let us to start.
See, this is what I mean.
Okay.
You keep switching things around, making it confusing.
Okay. First of all, I want to share.
Just spill
Okay,
everything, judging me.
Amir, can you listen to me? I want you to be sure that everything we discussed today is confidential and you are safe here. Okay? And I'm here just to help you. Okay?
Confident. That's what they always say, but then things get out and suddenly more people know my business. How do I know you're not just saying that to get me to talk? I don't even know if this room is safe. There could be something hidden right now, recording us both.
Okay, Amir. I'm a doctor and just I want to help you. Nothing is hidden here and you are safe. I promise.
Saying that, how do I know
Okay?
for sure? Anyone could put on a white coat and say they're a doctor. That's not proof to me. For all I know, you could be part of the group watching.
الصوت بيقطع ما قادرة أسمع. Can you repeat what you say? باين إنه أنا I lost my connection. كأني ما سامعه.
Not making any sense right now. Is that? See,
Okay, Amir. Can you tell me
listeners
what
got
brought you here today?
interference from their devices. They don't want me to speak.
I would like.
That's obvious. You see it too, right?
Amir, I would like to understand what brought you here today. Why you are with us today?
You really
Are
want
you
to know
hearing me?
people because she thinks I'm not myself.
What? Can you repeat what you say?
Waiting.
What you
Waiting
said?
for what? If you mean for them to stop watching me,
I'm not here for watching you. I'm
ask
here for helping you.
why are
Okay?
you trying to catch? I don't know what you mean, but
Okay, can you describe what you have been experiencing today, or that thing brought you to us
thanks
in
now.
the hospital?
It's on purpose.
Amir, are you with me?
That's what. You keep stopping halfway and then you want me to trust you? I'm here, but
I can
that doesn't mean I'm with you. I don't know if I can trust you yet.
I can't understand what you say.
You can what? You
Just try.
are you hiding something? Or
I'm not hiding something, okay? I want to help you. Just describe what's happening with you.
can't
Just
finish?
describe to me what's happening with you. What brought you to the hospital today?
You keep saying you want to help, but I don't know what you really want.
Okay, okay, I will help you with my questions.
You're acting
Just
strange. Doesn't get it.
you need just to.
She thinks I'm losing.
Okay, I mean, do you think what? You are losing what? Can you repeat what you say?
You keep asking me to repeat myself, but it feels like you're not really listening.
Sorry,
I
okay,
still-
sorry, I
That's okay.
just lost my connection, so I repeat the question. I'm
انا
too
هوقف
sorry.
شويه صباح، معلش هوقف شويه.
Okay.
صباح يعني انا هتعيد الكيس تايم من الاول، ما عايز الكيس تفوت عليكي، هعيد الكيس تايم من الاول، في مشكله هنا حاصله هسه.
كلامه ما واضح، وفي كم مرة كده صوتي يعني الشبكة
ما
قطعت
انا
عندي.
فاهم، لكن المشكله اللي حاصله انه بتتكلموا انتوا الاثنين في نفس اللحظه. الحاجه دي لما
اوكي
تحصل ما في زول يفهم الثاني، الكلام حيطلع مقطع، الكلام ممكن يبقى بعد شويه في حديه في الكلام. عيدي من الاول بس هنا بالنظام ده. اذا تكلم وقفي، اسمعي كلامه كله لحد
اوكي
الاخر، بعدين اسالي. لانه عدم
اوكي
السماع ده يمكن في 5 دقائق راحت، بس انت قلت شنو بتعيد ليه، انت بتستني عيد الكلام. يعني في you're missing the main
آه.
point هنا. خلاص.
اوكي بدينا اصلا نخش في كونفليكت.
ما عدم في كوميونيكيشن بروبلم هنا، فدي ساعات ممكن تحصل. نحاول نتجاوز الحاجه دي بانك الليله لو اتكلم استنيه لحد ما يخلص كلامه كله، ما قاطعه.
اوكي
واحد بس
حاضر.
يتكلم عشان الكونفليكت ما يحصل، الكلام بيبتدي يبقى حاد بعد شويه.
اوكي
وبعدين it's the usual thing انه العيان البارانويد they challenge you, they don't trust you. It's a trust issue. Part of البروسس انك الليله to try to explain the role. يعني understand exactly like I mean this might be difficult and not to trust people. ما تاخذ الموضوع personally. It's sometimes very
اوكي
difficult, to trust people here, and I agree with you. But I can tell you, I can assure you, everything here you're saying is confidential, and we're here to help you.
اوكي
And I've heard this with multiple people, and I understand. But I'm here to help you, and this exactly like I mean I'm interested in what brings you here. Tell me what brings you in.
طيب اوكي
خلاص، ما تاخذ الموضوع personally هنا، بالذات العيانين البارانويد الديلوجنال، ما تاخذ الموضوع personally. It's a process في الآخر.
اوكي
يلا.
What do you want? You're just like the rest, aren't you?
Hello Amir, I'm Dr. Sabah. I'm a psychiatrist registrar, and I'm here to help you today.
Yeah, that's what they all say. Here to help. But I know how this goes. People come in acting all friendly, then twist things around. You probably already know everything anyway, don't you? You've got your notes, your cameras, and your microphones. Don't pretend you don't.
Okay, I want to say that everything we discuss here is confidential. I know it's sometimes difficult to trust people, um, but um I'm here just to help you, okay? I didn't have cameras, I didn't have any record or something like this.
Sure, you'd say that. That's what you're supposed to say, isn't it? You want me to believe you. But how do I know you're not lying? People always say it's confidential, but things always get out. I know what I've seen. Don't try to make me think I'm imagining things.
Okay, I know it's sometimes difficult to trust people, but let us to try here, okay?
You keep saying that, but it doesn't change anything. It's not just about trust. You don't know what it's like trying to watch your back all the time. You say you're not recording, but I can't just ignore what I feel. Things aren't safe. Not for me.
Okay, I know it's a difficult experience. I know that uh, so distressing. I'm sorry that you are going through that. I'm here to help you. I will
You're
ask you just a
not
few
the one
questions,
doing this.
okay?
You don't have people watching your every move or voices that won't leave you alone. Saying sorry doesn't make it stop. You have no idea what it's like.
Okay, yes, I don't have the idea, but I trust that a distressing thing, okay? I'm here also to help you. I can ask you a few questions.
Trust? That's
Okay,
why do
can
you
you
need to
tell me
ask?
what?
What are you really looking for? Are you trying to catch me out? Or is this just another way to get more information for them?
No, it's not like you think. Okay, can you tell me what brought you here today? I would like to understand this in more details.
Understand. You want to understand.
Yes, I want to understand what brought you to
Nobody
the
ever really.
hospital today.
They just asked, said that things got worse for me. So why should I believe you? Why does it matter? You probably already know. My mom called you, didn't she? She always thinks she knows best, but she doesn't get it either. None of you do.
Okay, can you describe what you are experiencing? Have you hearing voices when no one is around?
Why are you asking that? Are you trying to trick me? Maybe you want me to admit something you can use against me. The voices, fine. Yes, I hear things. But they're not just voices. They know things. They warn me. They tell me about people like you.
Okay, what do they say to you?
Why do you want to know that? Are you going to write it down somewhere? They tell me not to trust
No,
people.
just I'm just trying to understand. Okay.
You keep saying that, but it doesn't make me feel any safer. The more you ask, the more I wonder what you're really after. Maybe you should just leave it.
Okay, I know that uh, this hard experience for you. I know it's difficult to trust other people, but let us to try. Okay, do these voices talk
No,
to you
no, what?
or about you?
Not really. People say, what do you mean, do this point? Are you trying to catch me out or twist my words again? You're not making sense.
Okay, Uh, you said that you have been hearing voices. Is it right?
Why do you keep asking about the voices? Are you trying to record what I say? They told me you would do this. They said you tried to get information out of me. Why should I tell you anything else?
Mm, okay, let us move from the voices. Do you feel like someone watching you or trying to harm you?
Of course I do. That's what I've been telling you. There are cameras, microphones everywhere, even in places you wouldn't expect. People watching from across the street, from the mosque window, even from the lampposts. I can't go outside anymore without feeling eyes on me. You think I'm just making this up?
Okay. Uh, why do you think they do this? Why they are watching you?
Why do you think? Because they want something from me. Maybe they want to control me or see if I slip up. Maybe they're waiting for me to do something wrong so they can come for me. I don't know exactly, but I know it's real. I've seen them move things around in my room, heard them whispering, changing frequencies. They know everything.
Okay. What make you believe this is happening? Do you have a proof or something like that?
What are you even saying? Heaven? Proof? Are you trying to confuse me on purpose? This isn't some fantasy. This is my life. If you're going to mess around with words, I'm done talking.
Okay, how certain are you about this?
How do you think I feel? I'm exhausted, can't sleep, can't eat, can't trust anyone. I'm always on edge, waiting for something bad to happen. It's not a life, it's just surviving.
Okay. Uh, uh, do they stop you from going outside or
Are you still there?
go to the work? Yes, I'm there. I ask you that. Do they stop you from going outside or talking to the people or going to the work?
Yeah, they do. I can't step out without feeling like I'm being watched, like someone's waiting for me. Even just looking out the window at the mosque, I know they're there. I used to go out, used to work, but now I just stay in my room. Can't risk it, can't trust it. It's not safe.
Okay, this has happened recently or from long time or when did they start to watch you?
But are you still there?
Yes, I'm still there. I'm asking about uh, when they start to watch you.
It started a few months
You
ago. At first, I just felt uneasy, like something was off. Then I started
mm,
noticing stuff moved around, weird noises at night, flashes from the mosque window. After that, the voices came. Since then, it's only gotten worse. Now I can't even trust my own house.
okay. Um, that caused you to conflict with them? Amir, are you here?
Of course it did. How could it not? I tried to tell my mom, but she just says I'm being or make me slip
Uh,
up. I don't like this.
okay. Um, okay. Do you ever hear voices related to this thoughts or
What? I don't get what you're saying. Are you asking if this has something to do with work? I already told you I can't work. I had to stop because it's not safe out
No.
there. It could be anywhere,
Okay.
waiting. I can't risk it.
Okay. I'm asking you about the voices related to this thought. Do you hear any voices about this thoughts?
They talk about it, yeah. They tell me who's watching, warn me about certain people. Sometimes they say not to trust anyone, even my own family. They say things are going to happen, that I should stay inside, keep quiet. They're always there, reminding me. It never stops.
Okay. Are these voices are familiar to you? The voice of someone you know or something like this?
No, they're not familiar.
Okay. They are talking to you directly, like I'm
They're
talking
not
to you
people I
now,
know,
or
like hearing my mom or a friend. They're different. Yeah, sometimes. They talk straight to me, say my name, tell me things I shouldn't do or people to avoid. Other times they just whisper or talk about me like I'm not even there. It's always something.
okay. It's look like a sound from inside your head, like thoughts or ideas, or it's more like a conversation, like I'm talking to you now.
It's more like a conversation, like someone's actually there, not just in my head. It doesn't feel like my own thoughts. Sometimes it sounds like they're right next to me or coming from different parts of the room. I can't just ignore it, no matter how hard I try.
Yes, this very distressing. I'm sorry that you um, been through this type. Okay, is this voices ask you to harm yourself or other?
No, they don't tell me to hurt myself or anyone else. They mostly just warn me, keep me on edge, say not to trust people or that someone's coming for me. Sometimes they tell me to hide or check for cameras again, but they don't tell me to do anything violent.
Okay. Um, how is your sleep?
Terrible. I can't sleep most nights. I'm always listening, checking if anyone's around, watching for movement. Even when I do fall asleep, I wake up a lot feeling like something's wrong. It's never restful.
Okay, what's about your appetite?
What do you mean? My habitat. If you mean eating, I barely eat.
Appetite, yes, eating.
Food doesn't feel safe anymore. Sometimes I think it might be tampered with. So I just don't bother much. My room is the only place I stay now.
Okay. Okay. Have you ever experiencing something like this before?
No, never. This just started a few months.
Okay. I will ask you a question that I'm asking to all my patients. Okay. Do you use cannabis, alcohol, or any drugs?
No, I don't touch that stuff. Never have. I don't drink. I don't smoke. Nothing like that. I don't want anything messing with my head more than it already is.
Okay, it's good to hear that. Do you have any medical condition, seizures, head injury, or anything?
No, nothing like that. I've never had seizures or hurt my head. I've always been pretty healthy before all this started.
Okay, if there is any family member had any mental illnesses,
What are you talking about? I don't understand your question. Are you asking about my family or animals? I don't have pets, if that's what you mean, and my family is just
No,
my mom. Why are you asking about this?
I'm asking just to sure that there's no history of any mental illness in your family. It's routine questions.
No, not that I know of. My mom's fine. No one ever talked about anything like this before in my family. I'm the only one dealing.
Okay. Well, what do you think is causing this? Do you think it could be an illness? Yeah. قطع ولا؟
شكله قطع. هل هنا
أوريد
افتكر
أنا حاسة إنه الزمن انتهى أصلا.
هو تقريبا انتهى. انا
أيوة.
افتكر يعني عشان نعيده تاني it's not even worth it. كده افتكر في مشكله في
مم.
الشبكه. طيب دكتور مهجة.
طيب في البداية يعني
الو مهجة، صوتك اختفى يا مهجة. الو.
آم،
خلي، انا اعتقد يا مهجة، خلي ادي الفرصة للترينيز
مثلا
تو كومنت اباوت الهيستوري، الحاجات الناقصة شنو، وتو كومنت اباوت المنتال ستيت اكزامينيشن. اديهم الفرصة.
اوكي اوكي. طيب يا شباب نبدأ بالهيستوري.
لو ما في زول قال حاجة خلاص، خلي صباح تقول شنو الفيدباك بتاعها وشنو الحاجات المفروض كانت تسأل
المواصفات.
منها، والحاجات ما سألت منها مثلا. ولو عندها more time what she should have asked about، سواء كان في الهيستوري أو المنتال ستيت examination، الحاجات اللي نسيتيها يا صباح.
اوكي.
أوكي، يعني أنا صراحة حسيت إنه البيشن difficult شوية، فما كان متعاون معي.
وهي الواحده
أي
دي
difficult شديد، ما شوية. هو مخصوص جايب
شديد
منه
ايوه.
very difficult patient، ده واحد من أصعب المرضى ممكن يتعاملوا معاهم. you
ايوه
are right، لكن ما difficult شوية، difficult شديد. اوكي.
ايوه.
أوكي، فأنا حسيت إنه الأونست والكورس أوف ديزيز شوية كان المفروض نسأل منها زيادة يعني. لكن ما اداني فرصة. آه also كان المفروض نسأل من ريسك اسسمنت، أنا أظن سألته في النص كده يعني. برضه في شنو ما سألت منه، سألت من السبستانس.
خدتي
يمكن
forensic history؟
لا، ما أخدت فورنسيك هيستوري وما أخدت بيرسونال هيستوري. اوكي، لا بيرسونال برضه. البريموربيد بيرسوناليتي ما سألت منها. سألت من الانسايت. فيش من تاني.
شغال هو employed ولا unemployed، الفانكشننج بتاعه at a
أي
social level at a family level at work، عنده أي functioning ولا impaired.
أيوة، دي ما سألت منها. اللي هو يعني personal data كان المفروض أخدها in details شوية.
اوكي مهجة، لو عندك أسئلة عليها عن mental state examination.
طيب ما أعرف الباس هيستوري برضو مفترض يكون شوية. هو قال لا بس ما له مونسس كده، لكن هل قبل كده
مم.
كان يعني حصل له إبيسود ولا لا في الباس هيستوري؟
قال إنه دي أصلا تحصل له حاجة زي كده وما حصل مشى للسايكاتري دكتور.
برضو في الريسك اسسمنت انت سألتي من السوسايد والهوموسايد، لكن ما سألتي من الاجريشن فيولنس.
أمم. أمم. أوكي.
برضو لو تسمعوا يعني البيشنت طبعا هو يعني غالبا سكيزوفرينيا بارانويد تايب يعني، بس انه
أمم.
عنده suspicious about يعني كل الناس اللي حوالينه not trusting anyone وكده. لكن طبعا ده ما typical age of onset بتاع البارانويد تايب، مش سكيزوفرينيا. البارانويد بتيجي في الميدل ايج افتكر، يعني يمكن دي حاجه ما typical معاه. لكن عنده second person، عنده third عنده third person، عنده
commanding.
commanding.
أمم.
ايوه
أمم.
بالظبط برضه. ويعني حتى أصلاً عنده ideas of reference في people are spying on him persecuted delusion. يعني كان full of psychopathy. وشايف حتى
أمم.
كنت عايز تسأل من الصوت ايكو، لأن طبعا ما ساعد.
ما اداني فرصة أصلا أسمعهم معه.
ايوه وكان في very difficult patient difficult to establish رابو معاه. ولكن شايف في
أمم.
النهاية الموضوع ماشي كويس سلس شوية في آخر
أمم.
يعني في آخر الكونفرسيشن ما شاء الله. شايف بقى يتجاوب معاك.
أوكي.
شكرا لكم.
إيمان.
السلام عليكم، يديك العافية
عليكم
صباح.
السلام.
You did a great job لأنه كان really difficult patient. آم،
شكرا.
في كم حتة كده صغيرة بس. يعني
مم.
البيشنت كان يتكلم عن he was hearing voices, he was suspicious. فكان
أمم.
كويس لو سألنا عن ال other psychosis اللي هي زي ال hallucinations, other hallucinations, visual, olfactory. طيب، وتاني حاجة other
مم.
delusions. يعني if he has any delusion of reference, delusion of control, a thought insertion, withdrawal, broadcast. وتاني how does he cope؟ لأنه قال it's difficult time for him. How does he cope؟
أمم.
والريسك زي ما
أوكي.
انت سألتي عنها، بس انه لأنه هو قال إنه he's going through a difficult time. Have you ever ممكن تجي بطريقة تلقائية كده إنه have you ever thought about ending this all by harming yourself؟ وآخر حاجة
أمم.
معلش المرض، هو قال لك مرة she thinks she knows everything. فقول لها how's your relationship with your mother؟ لأنه maybe he has some
أوكي.
suspiciousness toward her, maybe he lives with her. وشكرا لك كثير، يديك العافية.
أوكي. thank you.
لو ما في كومنتس انا عندي كومنتس اكشلي. انا افتكر الكيس دي اللي نثبتها لقدام. اتس فيري انترستنج كيس. والبرفورمانس بتاع صباح جبال في الاول، انه الموضوع بتاع اتس ان اسسمنت بتاع كوميونيكيشن. انا شايف ساعات الناس they jump into trying to establish the diagnosis هنا based on the psychopathology. This is not the goal. The goal is to يعني هنا improve our communication skills, how to do a history, how to perform a mental state examination. الصباح في الاول افتكر كان في مشكله انه هي هي الكوميونيكيشن اللي هي مدي مثلا العيان بيتكلم، عيان is very angry, very suspicious, very unpleasant. كان في وعين الشبكه ما كان كويس، ما مساعد ذاته. الناس لما تتكلم فوق بعض الكوميونيكيشن بيبقى حاد، الوقت راح. لكن لما بدينا تاني الموضوع اختلف تماما. فبقت بس he's a challenging patient. How to address a challenging patient is a skill. عشان كده انا افتكر الكيس دي تتثبت لقدام، لانه it's a very ساعات بتجي في الاوسكي ذاتها. How to deal with an aggressive ولا angry patient. How to redirect them. How to control the time. How to reassure. الحاجات دي it's a skill بتاعت assessment. فافتكر صباح you did really well في الموضوع ده، وكل ما كان الزمن مشى كل ما الكنترول على الكيس بقى احسن واحسن. فيعني انا give you the credit for الكيس دي. انا I did not know ان الكيس هتكون بالطريقه زي دي، لكن انا truly I enjoyed it. It's a very interesting case. ومفروض الناس دي كلها تجرب اللي قدام. افتكر نثبت الكيس اللي قدام مره مرتين وثلاثه. It's very interesting. حاجة تانية بالنسبة للديفرنشال في الكويستنز. This is a first episode psychosis. First episode psychosis الديفرنشال بتاعك زي ما قال خلف الله schizophrenia. لكن this is an angry irritable guy. Irritability can be the sign بتاعت for a first episode انت you cannot differentiate is this schizophrenia is this bipolar disorder. ما هتعرف عشان كده you should ask the questions بتاعت المانيا. تاني you ask about the sleep, you ask about the appetite, لكن I will go further in asking questions about the manic episode before ولا depressive episodes in the past. ما بقول لك it's bipolar لكن it should be part of the differential, it should be part of the questions.
Okay.
دكتورة مهجة أي حاجة تانية؟
هو الكاس challenging هو في نفسه، وغير كده الزمن ضيق. يعني I think إنه لو كان في real life كان ممكن التفاعل يكون أحسن، الزول كان ممكن يكون مرتب أكتر. فأنا حسيت إن أنا عايزة أسكه كده وأخلص وألحق الزمن.
وإتس سكيل ذاته، إتس سكيل إنه how to manage يعني an angry patient.
Okay.
أنا بتفق معك ياسر، وأنا أعتقد ما في مشكلة إنه نعيد نفس الكيس في سيشن تاني قادم في الأسابيع الجاية. نفس الكيس دي نعيدها with another trainee، لأنه very very interesting case زي ما قلت. و حيتعلموا بيها، يعني we can improve our uh, communication skills والتوليرنس بتاعنا برضو، والبيشنس حقنا مع البيشنس زي ديل، وكتير بيجونا in real life يعني. فممكن نعيدها تاني بعد في النكست. طبعا الاس بي اي ما بيتكرر الا بعد 4 اسابيع تاني. ممكن نعيدها تاني يا ياسر ومهجة.
وفي الكيس زي الناس بيرسونال يطلع الموضوع ده بتاع البيرسونال ده تماما، وافتكر الموضوع ده ظهر في الاخر يعني مثلا في every time and so الموضوع ده يعني بقى اسهل.
يس شور.
طيب نخش في next
اوكي
case.
next case. ايوه منول. who's going to take it? A trainee who never participated. يلا شباب، زي ما صباح اتقدمت، واحد وواحدة تتقدم للكيس الثانية.
اخوانا
أنا ممكن أواصل الكيس الثاني، ما عندي مشكلة.
ده
انت
لا
اخدت فرصتك يا
يقدم،
صباح.
خلاص يدي فرصة للباقي قدمه،
ايوه.
ولا يقدم قبل كده يدي فرصة للناس اللي ما قدموا، عشان عايزين في نهاية الأمر الناس كلها تقدم.
وشايف في زول داخل ب يعني اي دي بتاع نوكيا جي 42 5 جي، نغير اسمه عشان لو عايز اتندنس يغير اسمه. يا اخوانا
والله
طب
منتظرين.
السلام
يلا
عليكم.
قدم.
أنا رانيا أنور. ما قدمت قبل كده، ممكن أقدم.
تمام يا
شكرا
رانيا.
لك شكرا شكرا. يلا تفضل يا ياسر، خلاص.
طيب رانيا عندك ريتشل هوردن. Okay, you are scheduled to consult with Rachel Horden, a 35-year-old marketing executive. She has been referred to you by her GP for issue related to sleep. Rachel has no other chronic medical conditions, but has been experiencing high levels of work-related stress. She has undergone routine blood tests, all of which have came back normal. She's eager to understand what is affecting her sleep and is looking for a treatment. Your task is to speak with Rachel and take a detailed psychiatric history to arrive to a potential diagnosis. دي ما focused history، مع انه ال presenting complaint is insomnia، لكن لسه ما focus history. ده شكله it's a full assessment.
أيوة،
Okay؟
أوكي تمام.
السكرين ما أظن ظهر.
سو معلش
طلعت
ثواني.
الشركة.
غريب، انا غريب. دقيقة. ثواني مش خلاص. دقيقة، انا جاي للموضوع ده. اوكي. طيب كده زهرة.
لسه لودينج.
كده يبقى شغالة بتحمل
آمين.
لودي معي.
طيب افتكر يعني انا ارجع لكم تاني. دي ريتشل هوردن. زي ما قلت الكيس بتاع البرزنتيشن جايه هي فور كونسلت، فانا انت في الاوفيس. والريفيرال جايه من البي سي بي، البرايمري كير بروفايدر جي بي، for issues related to insomnia. لكن تتكلم عن chronic medical conditions ما في اي حاجه. blood work everything came back normal. She's dealing with stress related to work and she's eager to learn more about what is going on and how she can يعني what can help her. It's a full assessment في الآخر. Insomnia refers to difficulty falling asleep, staying asleep, or experiencing non-restorative sleep despite having an adequate opportunity for sleep, leading to daytime impairment. It can be classified based on duration into acute, short-term, long, or chronic, lasting 3 months or more, occurring at least 3 nights a week. ICD-11 and NICE guidelines. It emphasizes the importance of distinguishing primary insomnia from insomnia related to secondary mental disorders, medical conditions, or substance use. The NICE guidelines for diagnosis and management of insomnia recommend cognitive behavioral therapy, CBT, as the treatment of choice for both short and long-term insomnia in adults of all ages, unlike medications. The guidelines also emphasize the importance of accurate diagnosis through a thorough evaluation that includes detailed sleep history, assessment of daytime consequences, and identification of comorbid medical, substance, and psychiatric condition. Non-medication treatment and pharmacological therapies are available for management of insomnia with empirically supported treatment, including non-medication therapies and medication options. Additionally, the guidelines highlight the use of questionnaires like Epworth Sleepiness Scale, Insomnia Severity Index, Dysfunctional Beliefs and Attitude About Sleep, and Pittsburgh Sleep Quality Index to aid in the evaluation of insomnia. Polysomnography is recommended when there is a suspicion of other sleep disorders like sleep apnea or periodic leg movement disorders, or when initial treatment fails. Communication skills. Empathy and active listening. This is general لكل cases. Show understanding and empathy toward Rachel's concern. Active listening can help her feel valued and more open to sharing sensitive information about stress and sleep habits. يعني هتتكلم انه insomnia, she hasn't slept now for يعني extensive period of time. You have to show like that sounds terrible. I'm sorry about your experience. And I'm glad that you came here so we can help you. حاجة زي كده. Open-ended questions encourage Rachel to describe sleep problems and stressors in her own words. This can provide a fuller picture of her situation and help in identifying underlying causes. Summarization. Periodically summarize the information Rachel provides. This ensures you have understood her correctly and allows her to clarify any misunderstanding. يعني بعد ما سافر يقول لها so Rachel, you've been telling me you've been having issues with sleeping now for the last 3 to 4 months. It sounds like you've been dealing with stress at work. This condition, like the problem is sleeping early in the morning. You're unable to feel refreshed. And الموضوع كده 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 كده. Is that correct? Yes. Is there anything else that you want, like that you think is important that I need to know about? Summary كده. في الآخر from time to time. دي في الآخر. A summary. Potential questions to ask. هنا الكلام هنا ده الحاجات دي حاول تتذكريها لأن دي حتسأليها. Can you describe your typical night sleep? How long does it take for you to fall asleep? Do you wake up during the night? If so, how often and how long does it take to fall back asleep? What time do you usually wake up? Do you feel rested? Okay. Daytime functioning. How do you feel during the day? Do you experience fatigue, mood changes, or difficulty concentrating? Has your work or daily life been affected by your sleep problems? Lifestyle and environmental factors. What is your routine before bedtime? Do you consume caffeine or alcohol? If so, how much and how close to bedtime? Do you use electronic devices before sleeping? Stress and psychological factors. Have you been experiencing increased stress or anxiety? Can you tell me more about these stressors? How do you usually manage your stress? Previous treatment and intervention. Have you tried any treatment or strategies to improve your sleep? If so, what were they and did they help? Medical history. Do you have any other health conditions or are you currently taking any medications? Okay. طيب يا رانيا.
معلش دكتور ياسر، قبل ما نبدأ عايز أسألك عن حاجة، إنه حاخد منها البيرسونال داتا ولا حنكتفي باللي أصلا مذكورة؟
عادي، انت الليله ولا كانك سمعتي حاجه، انت دي الليله بس كده عشان تعرفي ابتدي من الاول.
طيب
Is,
طيب
is, hello, my name is Dr. Rania. I'm the psychiatry registrar here in the office and I'm happy to help you. What brings you here? طوالي بس open ended. ابتدي من الأول. ما حتى اسالي عمري ايه، ممكن البيرسونال العمر والحاجات دي ما عندك شغله بها، بس طوالي open ended question.
طيب
جاهزه؟
جاهز تمام.
Hello, thanks for seeing me today.
Hello, how are you, Rachel? I'm Dr. Rania.
Sorry, I'm not sure I follow what you mean.
I'm Dr. Rania. I'm a psychiatry registrar here in the office. I'm here to help you. I will be happy to help you. Can you tell me what brought you here today?
Look, I'm honestly just exhausted. I can't fall asleep at night no matter what I do. I've tried everything people suggest. No caffeine, regular bedtime, no screens.
I'm sorry to hear that, Rachel.
Your solution?
Can you tell me how long this problem started? When did it start?
It's been going on for at least 6 months now, maybe a bit longer. At first I thought it was just a rough patch at work, but it hasn't let up at all. Every night feels the same, just lying there waiting for sleep that never comes.
Can you describe more your sleep at night?
If you mean what my nights are like, basically I get into bed, try to relax, but my mind just keeps racing, mostly about work stuff. I toss and turn for hours, sometimes until 2 or 3 in the morning. It's exhausting, and nothing seems to quiet my brain down.
Do you wake up at night? After you fall asleep, I mean.
Not really.
Do you wake up? What time do you wake up in the morning?
Once I find... Usually around 6:30 or 7, whether I've slept or not. I can't really sleep in, even on weekends. It doesn't matter how little sleep I get. I still wake up early, which just makes everything worse.
Okay, sorry to hear that, Rachel. Can you tell me, when you wake up in the morning, do you feel rested?
No, not at all. I feel groggy, unfocused, and honestly kind of irritable most days. It's like I haven't slept at all, even if I technically got some hours in. It's really affecting my mood and my ability to get through the day.
Okay. Do you take naps during the day?
No, I don't. I can't really fit naps into my day with work, and honestly, I'm too anxious to even relax enough for one. If I tried, I'd probably just end up thinking about everything I need to do.
Okay. Is this your first time to have this problem?
Yeah, this is the first time it's ever been this bad. I've had stressful periods before, but never anything like this.
Did you try any strategies to help you or any medications?
I just can't fall asleep night after night for months. Thanks. I appreciate that. I just really need something that actually works this time. I'm so tired of feeling like this every single day.
Can you tell me about your mood during the day?
Are you still there?
Yes, I'm here. I'm listening to you.
During the day, I'm constantly tired and on edge. During the day, I'm honestly running on fumes. I have to push myself to focus at work, but my concentration is shot. I get irritated easily, and sometimes I just feel like snapping at people. By the time I get home, I'm totally drained, but still can't relax.
Okay. Uh, how about your interest in social activities or other activities you used to enjoy before?
I'm not really sure what you mean by that. If you mean internet use, I try not to use my phone or laptop close to bedtime. I've cut out screen at least an hour before bed, but it hasn't made any difference with my sleep.
Okay. How is your energy during the day?
Sorry, can you clarify what you mean? How is what? If you mean my
Your
mood or something else, just let me know.
Yes, I mean your energy during the day. Do you do the same activities you used to do?
My energy is way down. I still try to do everything I have to for work, but it takes a lot more effort. I don't really have the motivation for anything extra, like social stuff or hobbies. Most days I'm just trying to get through without crashing.
Okay. That must affected your relations to others. Is it affected?
Yeah, it's definitely affected things. I don't really see friends much anymore. I just don't have the energy or patience to deal with people after work. Honestly, I feel pretty isolated. It's just easier to be alone when I'm this tired and irritable.
Okay. Have you ever wished that you are dead or wished for death?
No, I haven't wished for death. I'm just exhausted and frustrated. I want to feel better and get my life back on track, but it's never gotten to that point. I just really need to sleep and feel normal again.
Okay. Rachel, do you feel worried during the day sometimes? I mean, excess worry?
Yes, I worry a lot. My mind is always racing about work, deadlines, whether I'm keeping up. I can't seem to switch it off, even when I'm supposed to be relaxing. It's constant, and it makes everything else harder to deal with.
Okay. Do you feel muscle tension sometimes? Your back ache or shoulders ache?
هنا داخل افتكر راحت. ما اعرف شكل في مشكله عندي في الشبكه الليله. نبتدي تاني.
طيب اوكي تمام.
ثواني. دقيقه.
هو قطع بسبب الشبكة يا ياسر؟
غالبا ده من عندي انا.
مم.
لانه ذاته في نص الكلام ساعات بتسمع قطيع فانا ما عارف المشكله وين. دقيقه. دقيقه. كده انا هحاول اقفل هنا دقيقة عشان البتاع ده ما يروح. انا خليني اكتب عبد الغني ده اقلب الشبكة بتاعت النت. شوف انه دي تاني مرة تعمل الحركة
اوكي
دي.
اوكي.
هقوم اعملها بالتليفون بس ثواني اخليك
لا ما
الليلة
في مشكلة.
لو قطعتها.
اوكي. طيب لحد ما يجي ياسر نستفيد من الزمن. هل لقيت شنو يا رانيا المين كومبلينت بتاعت شنو كانت؟ what is her main problem؟
Her main problem is difficulty falling asleep. Insomnia started 6 months ago. Uh, she has other symptoms of anxiety, like decreased concentration. I asked about muscle fatigue، لكن الشبكة قطعت قبل ما أسمع الأنسر حقتها. She has excess worries, feeling on the edge, irritable mood most of the time. كنت حسأل عن أعمل screening للdepression manic episodes before psychotic symptoms.
لا خلينا من before in the past.
أيوة.
هسه حاليا
أيوة.
other complaints other than difficulty falling asleep, is it an initial insomnia بس ولا عندها other sleep disturbances؟
Only initial insomnia. ما في interrupted sleep. She sleeps through the night. She wakes at the same time every day.
Okay. Activity, functioning.
It's affected. Also, the relationship to others is affected. Mood also.
الفانكشنينج affected weight في شنو؟ الفانكشنينج الامبيرد
أيوة بتقول
فانكشنينج في شنو؟ في two
في الwork
areas.
بتقول it
Work.
takes her more effort to do the same things that she used to do.
mental effort or physical effort؟
ما سألت
يعني
exactly إنها
ايوه ما الeffort does she feel weak, fatigue, she cannot continue physically, or it is it's a problem of concentration and cognitive abilities؟ الeffort
أوكي
ده إذا لازم نعرفه نحن في two area. اوكي. تاني
أوكي حاضر.
شنو؟
هي اشتكت من concentration. She has decreased concentration.
اوكي.
obviously أيوة في physical في معلش mental mental effort.
اوكي. اوكي. so دي another symptom. ال concentration مع ال poor sleep. what about the mood؟
يعني اشتكت من irritable mood.
prevailing mood irritable. okay.
Yes.
دكتور عبد الغني
يس حبيبي.
ما
ايوه
قدر
ياسر.
اعمل حركه. تقدر تعمل لي هوست تغير بس شوف
جدا
بتاعتي رايت كليك واعمل رجعني هوست.
جدا. لحظة.
تمام شكرا دقيقه 7 ده
يديك العافية.
دقيقة كده، احنا الشبكة، ياهو الشبكة على التليفون.
يس، ظاهرة كده.
نبتدي نبتدي تاني.
طيب اوكي تمام.
يا أيوة. أوكي، معناها واصلي في الحاجات اللي ما سألتي منها يا رانيا، مش كده؟
حاضر حاضر تمام. أبدأ من الأول خالص صح؟
هاي.
ايوه هي هنبدأ
تمام.
الكيس من الأول.
هتيجي كده. هوريكم معانا التليفون ده معنا في اخير الشبكة بتاعت هاي.
الموضوع
لا
بيشتغل
هو يا دكتور ياسر، لا شكله مشكلة في الهناية، لأنه أنا هسه مشغلة وبرضه حصل لي نفس الحاجة دي، فشكله
في
مشكلة
في
في التطبيق ذاته.
اه
أيوة، في هنا ذاته في الآب.
في السيم في
أيوة
السيم.
صح.
كده نجرب تاني. انا رجعت
another
هاي.
case، ممكن تشوف another case يا ياسين لو ما هناي.
هي ما في الكيس معين، افتكر في ذاته في الصفحة بتاعتهم.
أوكي. مم.
بس نجازف، بس ما عندنا حل الليلة.
كويس.
لغاية الليلة ده حيرنا. كده عجيب.
Hello, thanks for seeing me today.
Hello Rachel, I'm Dr. Rania. I'm psychiatry resident here in the office. I will be seeing you today. How can I help you?
Look, I really just need help with my sleep. I can't keep going on like this. I'm exhausted and it's messing with my work and honestly everything else. I'm hoping you actually take this seriously. It's not just stress or a bad night, it's every night.
Okay, I'm sorry to hear that. Can you tell me more about the problem? When did it start?
It's been going on for a few months now. I just can't seem to fall asleep no matter what I try. I get into bed and my mind just races, usually about work stuff. It takes hours before I finally drift off, and by then, it's almost morning.
Okay, can you describe your sleep? Do you fall asleep immediately?
No, I definitely don't fall asleep immediately. It usually takes me at least a couple of hours, sometimes longer. I'll be lying there staring at the ceiling, just overthinking everything. It feels like my brain refuses to switch off.
Okay, sorry to hear that. Okay, tell me, once you fall asleep, do you wake up many times during the night?
Not really. Once I finally fall asleep, I tend to stay asleep. It's just getting there that's the nightmare. I don't wake up a bunch of times or anything, but I never feel rested in the morning because it's always so late by the time I actually sleep.
Okay. What time do you wake up usually?
It depends, but usually I'm in bed by 11, sometimes earlier if I'm desperate. But I don't actually fall asleep until 1 or 2, sometimes even 3 a.m. And I have to be up at 7 for work, so you can imagine how that feels.
Yeah. What time do you wake up?
I have to get up at 7 a.m. for work, no matter what time I finally fall asleep. So most
Okay.
nights I'm running on maybe 4 or 5 hours of sleep, if
Okay.
that.
Yes.
It's exhausting.
Yes, I know how hard it is. Um, does it affect your work in any way?
Absolutely, I'm so tired all the time that it's hard to focus. I make mistakes I never used to, and I feel way less productive. It's embarrassing, honestly. My job is stressful enough without adding this on top.
Mm-hmm. Does it affect you in any other ways?
Yeah, it does. I'm more irritable and anxious than usual. I snap at people and I just don't have the energy for anything outside of work. I feel isolated, like I'm just dragging myself through each day. It's really wearing me down.
Okay. How is your mood during the day?
Honestly, pretty bad. I'm on edge most of the time. I get frustrated easily and little things set me off. I feel anxious too, especially. Are you still there?
You know? Yes, I'm listening. Do you still do the same activities you used to enjoy before?
Exactly. It feels like I'm. Not really. I barely have the energy. After work, I just want to collapse. I used to go to the gym or see friends, but now I just stay home. I can't remember the last time I actually enjoyed something outside of work.
Okay. Do you have low mood sometimes?
Yeah, I do. It's hard not to when you're this tired all the time. Some days, everything just feels pointless. I try to push through, but it's getting harder. The lack of sleep really messes with my head.
Tell me more about your appetite.
My appetite's all over the place. Some days I barely eat because I'm too tired or stressed. Other days I just snack mindlessly to stay awake. I wouldn't say I've been eating well lately. It's definitely not normal for me.
Did you lose weight?
Yeah, a bit. Not a huge amount, maybe a few pounds. But I think it's just from skipping meals or not having much of an appetite. It's not intentional.
Okay.
All right, is there something specific you want to know next? Because honestly, I just
Yes.
need some practical advice or real solutions. This is really
Okay.
starting to take a toll on me.
Yes, I need to know more about your problem so we can reach a diagnosis. Do you feel excess worry?
Yes, I worry a lot. Mostly about work, deadlines, meetings, making mistakes.
When did this start?
It just doesn't stop, even at night. It's exhausting.
Hello?
Are you still there?
Yeah. I asked you
Oh, yeah, sorry, I
when
just get
did
anxious
the
when there's
worry.
silence. I really need to find something that works for this.
It's okay. Just tell me
Sorry, I just
when
wanted to be
the
sure.
when did the worry problem started?
The worry has always kind of been there, but it got a lot worse when my sleep problems started a few months ago. Work got more
Okay.
intense, and since then, it's just non-stop. I can't seem to turn my brain off anymore.
Okay. Do you have muscle pain?
No, I don't have any muscle pain. My body feels tired, but I wouldn't say I have any specific aches or pains. It's really just the exhaustion from not sleeping.
Okay. Okay. Have you ever thought about death or wished for death?
Honestly, I get really down sometimes, but I haven't thought about her. No, I don't wish for death. I just feel overwhelmed and exhausted. I want things to get better, not worse. I'm here because I want help.
Okay. Okay, we will help you. Do you feel guilty sometimes, Rachel?
Yeah, I do feel guilty sometimes. I feel like I'm letting people down at work when I'm not performing like I used to. I also feel bad for isolating myself from friends. But mostly it's just frustration with myself for not being able to fix this.
Okay. Do you feel worthless?
I wouldn't say worthless, but I definitely feel less confident lately. Not being able to sleep and keep up at work makes me question myself a lot. It's not a great feeling, but I wouldn't go as far as saying I feel worthless.
Okay. Rachel, can you tell me?
I want to ask something else.
Yeah. Is it your first time to see a psychiatrist?
Yes, this is my first time seeing a psychiatrist. I've tried talking to my regular doctor before, but they just told me to work on sleep hygiene and stress. That didn't help, so now I'm here. I'm hoping you can offer something different.
Did you try any medications before to help your sleep?
No, I haven't tried any medications. I'm honestly pretty hesitant about taking anything for sleep. I've read about side effects, and I don't want to get dependent on something. I'd really prefer to try other options first if possible.
Okay. In the past, have you ever felt the same?
All right.
Hello?
Sorry, I'm not sure what you mean. Can you clarify your question?
Yeah, I mean the same problem. Did it happen to you before?
No, this hasn't happened to me before. I've always had this much trouble sleeping or felt this overwhelmed. This is the first time it's gotten this bad.
Okay. Did you ever experience periods of low mood?
Yes, I have. Since all this started, there are definitely days where my mood is really low. I feel down, unmotivated, and everything just feels harder than it should be. It's not every single day, but it happens often enough to bother me.
Um, uh, I want to know just about periods that has opposite mood to the low mood, like you have very elated mood, unexplained happiness. Did it happen to you before?
Not like this, no. I've had stressful times before, but this level of low mood and exhaustion is new. It really started after my sleep issues got worse. Before that, I could handle stress a lot better. This just feels different.
Okay. You're talking about stress. Can you tell me more? What kind of stress do you have?
It's mostly work. My job is really demanding. Tight deadlines, constant meetings, high expectations. Even when I'm home, I can't switch off. I'm always thinking about what needs to be done or what could go wrong. There's just no real break from it.
Okay. What about your house chores and daily activities?
Just let me know what else you...
Yeah. And self-care. Are you still taking care of yourself like you used to do?
Honestly, not really. I barely have energy for the basics. Dishes pile up, laundry gets left for days. I skip showers sometimes just because I'm too exhausted. I know it's not great, but it's hard to keep up when you never feel rested.
Okay. Some patients come here and tell us about voices they're hearing, people talking to them while they are alone. Did you ever experience something like that?
No, I've never experienced anything like that. I don't hear voices or anything unusual. It's just my own thoughts keeping me up, nothing
Okay.
else.
Do you feel like sometimes you're being watched by someone or someone is following you?
No, I don't feel like anyone's watching or following me. That's not something I've experienced. My main issue is just the anxiety and being unable to sleep, not paranoia or anything like that.
Okay. Do you think there is something can help you relieve these feelings and help you with sleep?
I hope so. Honestly, I've tried all the sleep hygiene stuff. No screens, no caffeine, keeping a routine. But none of it has made a real difference. I'm open to suggestions, as long as they don't involve medication right off the bat. I just want something that actually works.
Okay. Do you have any medical problems, like chronic medical conditions?
No, I don't have any chronic medical conditions.
Okay. Hospital admissions before? Surgeries?
I'm generally happy.
الليل الشغل ده عبان عديل. ما افتكر بعد ده it's even worth it انك to try it again.
مم. طيب باقي السؤال drug abuse وال pre-morbid personality وال personal history.
يا شباب أي زول عنده كومنت؟ الناس ساكتة ولا
بص
فيها مشكلة ولا أنا ما فاهم حصل شنو؟
يعني طيب مش محتوى
انا
كويس
كنت
يعني ما
دايره
شاء الله.
يمكن
اتفضلي.
لا I just want to say انه يعني كنت دايره اعرف اكتر about her work and her relationship with her colleagues لانه حسيت انه her insomnia or difficulty falling asleep كلها related to her thinking about her work. فكنت I would like to explore her work يعني the load of work, her relationship with her bosses, with her colleagues. Okay, how does she feel about going to work. فبس.
خلف الله.
ايوه يا بص يا انت طبعا يعني بس شايف ما شاء الله الدكتور مشيت كويس في الكيس وكانت هي كوبراتيف واكيد البيشنت انسايتد. بس طبعا كان انا يعني من كلامي حسيت انه في anxious anxiety about multiple issues. فكان اكسبلور حكاية more finances إذا كان عندها أطفال about kids her kids أو about relationships أو كده فممكن تمشي مع ال generalized anxiety disorder. لأن طبعا أكيد المفروض تتم 6 months وتكون about multiple issues يعني تكون according to the dating pipe. شكرا لكم.
شكرا خلف الله.
دقيقة شو بس.
ترى موجة الناس ساكتة غير اللي أنا ما أعرف أعمل شنو قصته شنو.
طيب نسمع رانيا، هي عندها حاجات لسه ما سألت منها. هي عموما أعتقد سألت عن حاجات الأنظمة كلها، وسألت عن الديبريشن، يعني symptom of depression ومانيا. فأعتقد إنه عندها حاجات الزمن أو الشبكة دي الحقيقة، لأنه كان باقي زي 4 دقايق تقريبا للكيك. ممكن تقول لنا الحاجات اللي كانت عايز تسأل منها؟
كنت عايز أسأل من ال substance abuse ال pre-morbid personality وال personal history in general. ال work history كنت حسأل منه في ال personal history إنه هو new job ولا لأ. بس كنت حسأل من كده.
طبعا برضو
ومن
الويك لو فيه
الهيستوري.
لو معلش بص معلش، بس
لا،
الويك ده لو فيه نايت شيفت وكده يمكن بعدين عمل البيت عمل تاني during the day shift وكده، فبقى يعني بيقول عليه نايت شيفت انسومنيا. طيب يعني هو طيب من الانسومنيا بيكون سببه من السيركاديان ريزم.
دكتور ياسر،
ايوه.
عندك أي كومنت؟ شايفة الشباب الليلة غير خلف الله وإيمان ورانيا وصباح، ما في زول يتكلم.
ما عندي فكره الناس ساكته ليه. انا غايته في الاخر يعني. ايمان اتفضلي.
آه، السلام
آه.
عليكم. شايفة رانيا برضو كان ممكن تسأل من السوشيال انزايتي، البرفورمانس انزايتي، السبيسيفيك فوبياس. أظن برضو مسألة عن السويسايداليتي.
كلام صح. افتكر بالذات السوسايد anxiety symptoms in general والسوسايداليتي فعلا.
لا. أيوة، أنا كنت حقول نفس النقطة اللي ذكرتها آفاق، اللي هي ال other anxieties، اللي هي الفوبياز، ال OCD، ال PTSD، لأنه يعني ممكن نمر عليهم نتأكد إنه ما في other anxieties.
تمام. هي غايته دايما، حتى الكيس دي يعني she's anxious، ظاهرة من التون بتاعتها، من السيمتومز بتاعتها. يعني she's even providing a lot of information. ويعني يعني she's making you anxious من التون بتاعت الكيس ذاته. فافتكر يعني some of the concern انه هي ممكن تجي حادة. يعني هي ذاتها لما she's providing the history، she's providing history بطريقة حادة. ف some effort should be done، ما كتير يعني to some extent about reassuring her, dealing exactly with the concern. She's complaining about insomnia والinsomnia is effect، لكن ظاهر انه الموضوع اكبر من insomnia. This is exactly as we gathered from the history، انه في الاخر في depressive symptoms، في anxiety symptoms. وانا افتكر هنا الموضوع كله ذاته كان في الكيس، غير انه الموضوع as a primary presentation for insomnia كان في underlying يعني depressive and anxiety symptoms. في حاجة انه هي دايما لما يجيكي مثلا كيس زي دي، انه مثلا بيقول لك انا جربت ان اتكلم مع البرايمري كير بتاعي مثلا اللي الجي بي، والجي بي قال لي اتكلمت على sleep hygiene. انا would like to know exactly what did you learn from the GP. What kind of sleep hygiene انت did the GP teach you about. ساعات اللي learning about this حاجة وimplementing it حاجة تانية، وساعات اللي علموا لك الجي بي ما بالضرورة انه يكون adequate ولا accurate. انا would like to review exactly what you have you learned. What are you doing exactly before you go to sleep? Can you tell me more about your routine? فهنا before you go to bed. What time do you go to bed? Tell me more about your routine. What do you do? زي ما بيقولوا هم الحين في الأسئلة ذاته. قال لي أي energy drink، tea, coffee, smoking, alcohol before you go to drink. Do you have your cell phone with you? Do you have a laptop? Do you have a TV with you? What do you do when you're unable to sleep؟ الحاجات دي كلها تفاصيل أنا would ask about it specifically. مش إنه بس عشان الليلة الجي بي قال لي أعملها معناتها إنه المفروض أكون عملتها بالتفصيل. الديسكونكت هنا دايما بيحصل كتير، فدي بس ممكن
يلا
اضافه.
يلا يا دكتور ياسر، هي لكن قالت الكلام ده في بداية السيشن. البيشنت بنفسها اتبرعت بالمعلومات دي وقالت she stopped taking caffeine, she stopped screen, she started sleeping at specific time. فقالت she tried everything وياهو she mentioned these three specifically.
اوكي. اي حاجه تانية؟ دكتور عبد الغني.
شكرا. أنا أعتقد she did well دكتورة رانيا. البيشنت ذاتها كانت cooperative وinformative، وزي ما قالت she volunteered a lot of information للبيشنت ذاتها، قالت حاجات كثيرة. في حاجات بسيطة missed، لكن generally she was very good I think. yeah. فأعتقد الحالات السهلة زي دي يعني برضه كويسة، لكن زولنا الصعب ذاك يا ياسر أنا لسه مصير نجيبه تاني. أيوه. ف I think this is good. أعتقد هنا we came to the end، إلا لو في زول عايز يضيف حاجة. دكتورة مهجة، دكتور ياسر، الترينيز، أي واحد عنده إضافة ممكن يضيفها.
انا اضيف حاجه على الاثنين، اللي هي طبعا الشبكه ما ساعدتنا، لكن دائما السكند ترايل لما فتحنا الكيس تاني انت يو كان تيل انه البرفورمانس اتصلح، يتحسن، الفوكس بيبقى احسن، الكويستنز
Yes.
بقت فوكس، يعني ساعات الانكزايتي بتاعت البرفورمانس it improves with performance, it improves with trials. عشان كده الناس ما تخاف تعمل، the more you practice the more you get better. انت عندنا ليه two cases a second trial was better than the first.
Sure. Sure. No doubt والله. Yes. No doubt. وبعدين الناس بترجع للتسجيل، لأنها ريكوردد كل الكيسز دي، برضو تستفيد تستفيد زيادة من لما ترجع للتسجيل. أيوه. Well done. أفتكر we can call it a night.
Before we call tonight، أنا دي المرة الأخيرة، النداء الأخير زي ما بقولوا، الزول الداخل ب account نوكيا إذا جنعان من الاتندنس بتاعه يواصل بنوكيا.
أنا أفتكر في بعض الناس visitors ولا ضيوف ولا ناس they are not supposed to be in the program، يعني بس عايزين يحضروا لفائدتهم، أعتقد كده. لكن أي زول زي ما قلت الاتندنس ناخذ بالأسماء نحن الموجودة. No doubt. اوكي.
طيب.
شكرا ياسر، شكرا مهجة، شكرا لكم. يس تفضل.
بس كنت عايزة يعني أنوه على الشباب ديل إنه أي زول ما عمل البحث بالذات اللي هم كملوا التدريب، مفترض إنه يعني يتواصلوا معي عشان يعملوا البحث. عندنا امتحان هيكون هسه شهر 4، وامتحان تاني هيكون شهر 8، فهم لازم يعني في الفترة دي يكونوا عملوا البحث حقهم، كملوا التدريب. والأصلا R2 يعني اللي في R2 مفترض عليهم يعني البحث، يحاولوا
طب
يتواصلوا
معلش
معي.
دكتور، معلش دكتورة مهجة، لأن أنا سألت دكتور خلف الله في الموضوع ده كم مرة من بعد ما خلصنا الحمد لله بروموشن 1. أنا ياهو بسأل في إنه أنا دايرة أبدأ البحث بتاعي، ودايرة أبدأ like ياهو to be connected with the supervisor and everything. لكن دكتور خلف الله قال لي لغاية أسي ما تحركوا في الموضوع، يعني I just want to start my research. So is there any possibility for me to start?
يا اخواننا answering your question، بعد ما طلعنا نتيجة promotion 1 قلنا انه every trainee who passed promotion 1 exam can start and submit البروبوزل بتاعه. اي زول R1 R2 R3 R4، اي زول خلص بروموشن 1، لان ده mandatory يخلص بروموشن 1 exam يبتدي في البحث. اي زول بحثه جاهز حسي خلاص جاهز، والسوبرفايزر سايند له في ال الفورم بتاع متابعة البحث انه خلاص خلص، يكلم دكتورة مهجة يقول لها أنا خلصت البحث بتاعي جاهز عشان تخطه في الليستة بتاعت شهر 4. وأي زول ما خلص يحاول يخلص يحصل امتحان شهر 8. أوكي؟ دي إجابة لسؤالك.
Yes, thank you.
شكرا يا أبس.
أوكي، شكرا لكم وشكرا ياسر، شكرا مهجة، شكرا لكل الحضور، وتصبحوا على خير.
تصبحوا على خير، نشوفكم الأسبوع الجاي إن شاء الله.
إن شاء الله.